notice a change in their vaginal discharge. While common, these changes often cause private concern due to the lack of open discussion surrounding reproductive health. When these physical indicators are ignored or hidden, opportunities for early diagnosis are missed. These shifts in color and consistency are direct signals regarding the body's internal state. Trichomonas vaginalis is one such indicator. This single-celled parasite moves aggressively through the reproductive tract, causing a highly transmissible infection. This figure represents 270 million global cases annually. However, as the data shows, exactly half of those infected experience no symptoms, which often leads to the unintended spread of the parasite. Discharge changes in response to specific conditions. Understanding these shifts allows for a clear assessment of reproductive health. Healthy discharge is typically clear, stretchy, or watery. These characteristics shift naturally during a woman's cycle, particularly during ovulation. A shift toward a thick, white discharge indicates an environmental change, frequently identified as thrush. These yeast cells are permanent residents of the vagina. They become an issue when surrounding bacteria that regulate their growth are killed off by antibiotics. This overgrowth causes intense itching, burning, and changes the discharge to a consistency compared to cottage cheese. A gray discharge indicates a different shift, bacterial vaginosis, or BV. BV occurs when the vagina's pH moves from acidic to alkaline. This shift is triggered by external factors, such as douching or the use of perfumed soaps. This condition produces a strong, fishy odor. The scent often becomes more pronounced immediately after washing with soap. Both white and gray discharges signal localized environmental changes. These conditions are manageable by restoring the natural flora of the reproductive tract. A shift to yellow or green discharge signals the presence of an external infection. Trichomonas vaginalis produces a frothy yellow-green discharge as the parasite infects the local tissue. Gonorrhea presents with a similar yellow discharge. In many cases, it is accompanied by pelvic or abdominal pain. These are curable bacterial infections. Public health efforts have focused on identifying and treating these specific threats for decades. Treatment requires a full course of antibiotics for the patient and all recent sexual partners to ensure the infection is completely cleared. Yellow and green indicators confirm a hostile infection that requires immediate medical assessment. Red and pink discharges are categorized based on the timing and context of their appearance. Toward the end of a period, the flow of blood slows significantly. This allows the blood to oxidize, which turns the discharge a dark brown or red before it exits the body. A pink tinge appearing shortly after intercourse is generally caused by minor friction or micro tears in the vaginal wall. The implications change if pink discharge appears unexpectedly after unprotected sex, particularly around the date a period is expected. This indicates implantation, where a fertilized egg attaches to the uterine wall. This process causes slight bleeding, often mistaken for a light period. If blood-stained discharge occurs after a pregnancy has been established, it is a primary clinical indicator of a potential miscarriage. Any pink or red discharge occurring after a woman enters menopause is a significant clinical finding. Postmenopausal bleeding is a warning sign for endometrial cancer. It requires an immediate diagnosis to ensure early treatment. Identifying these physical changes provides a clearer understanding of how the body is functioning. Maintaining this environment involves washing only the external vulva, wearing cotton underwear, and avoiding internal douching or perfumed products. It is important to note that hormonal birth control pills do not provide a biological defense against sexually transmitted infections. Physical barrier methods remain the only effective defense against the transmission of these infections. Local health clinics provide the testing and targeted treatment required to manage these conditions effectively. A change in discharge is a physical signal. Monitoring these changes and seeking professional medical advice is an essential part of health management.